Hey guys, and welcome to CF Awareness Day 12. Today I'm going to talk about the importance of exercise and CF patients. So, exercise is highly encouraged in CF patients. It's kind of a use what we got situation, and it can also help. The more fit we are, the more fit we can get our lungs, the better they can help fight off infection, and in some cases, exercise can actually increase lung function. So obviously, depending on where you are in your lung function currently is dependent on the type of exercise that you're going to be able to do, and also just the level of fitness. And I'm not going to say any specific numbers because for every CF patient it is different what they can do at. Of their FEV1, but generally the lower you are, the less high intensity exercises you can do, and generally the higher you are, the better high intensity. But like I said, every CF patient is different. So for me, mainly what I do for exercise is horseback riding, walking with my dogs, and occasionally running or jogging with my dogs. And for me, the horseback riding and the walking is generally okay. Whenever I get off a horse, I tend to cough a lot, but while I'm on the horse, I'm not coughing most of the time, so I'm able to get in a good cardio work. Walking, I can do pretty well for a while, and just dependent on how I'm feeling. And running is definitely harder for me. I can probably not even run for a minute straight, probably more like 30 seconds. And just gradually build it up. Around this time last year, or 2 years ago, I think it was 2 years ago, I was able to run a mile, but that was after training for running for a good 4 months. So, you just kind of have to work up to it. Just like if you're not with CF, and you just have to work up and build up your fitness. So, in the cases of, like, when we're in the hospital, even then, as much activity as possible is encouraged because, obviously, sitting in a hospital bed isn't any good for you, and also you just really want to use as much lung function as you can to try and maintain that. So, even in the hospital, we will do walking with physical therapy, different kinds of stretching, push-ups, Superman, all the things to try, and squatting, all the things to just try and build up fitness and use what we have. So even when we're in the hospital, we're trying to maintain a somewhat level of activity. So as important as exercise is, there's also this fine line that we have of not to push it too far. Exercise is encouraged, but there's going to be some days with CF like I experienced where you just don't feel good no matter what. And so you just have to have this fine line of when do I push it and when do I not. So I generally aim more towards the push it side than I do the not push it side, but that's just because sometimes I want to do something and I'm like, I'm gonna do it no matter if my lungs are protesting. But there is days like, for example, today it's a rainy day that I've just decided to take as a rest day and give my body a break. For example, my resting heart rate is 90 to 100 most of the time, and that's just because my body expends more calories sitting here breathing than a normal person. And so when I'm running or on a horse or walking my dog or something like that, I'm expending more calories than a normal person, and also expending more energy. And so sometimes you have to have this fine line of balance of exercise versus resting. So I hope that this gave you some insight. Basically, exercise and CF are kind of go hand in hand. It's very encouraged by doctors and just general CF community to exercise and just use what you got while you got it, and hopefully able to maintain that, and in some cases have it go up. So that's all I have for CF Awareness Day 12, and thanks for watching.